Good morning. Good morning, everyone. Dr. Ahrens is with us, and we talked in New York from last weekend about zeroing in on topics of what we could specifically talk about regarding Emulin. It's such a broad topic we can talk about, but zeroing in on today on what Emulin, how Emulin can affect pain, inflammation, specifically arthritis. So without further ado, Dr. Ahrens, good morning.
Good morning. Good morning. I guess it is morning most everywhere for us. I do appreciate the opportunity to come speak to you again. People ask me, what about Emulin and heart disease? What about Emulin arthritis? And the list goes on and on. And so I want to start out by saying Emulin is for everyone. Everybody should be taking it. There really should never be a question, well, should I take it if I have this or that? There's only one contraindication, which is if you're on blood thinners. And that is because one of the ingredients, quercetin, even though it's a very small part of Emulin, nevertheless, there is a remote possibility that extracts from onion quercetin can increase issues with bleeding. It has been shown that quercetin can increase blood thinning. So if you're on blood thinner, it might be like getting a little bit more, but it's like only 1 or 2%. However, we say avoid Emulin if you're already on blood thinners. Of course, if you aren't Emulin, you probably won't need the blood thinners. I mean, that's always this cycle here.
Yep.
You on Emulin, well, you probably don't need insulin. If you're on Emulin, you probably don't need a lot of NSAIDs. If you're on Emulin, you probably don't need the blood thinners, etc. But let's all remember that for people at a distance that are not our own patients, we can't give these general recommendations. So check with your personal health care provider. Okay, got that caveat out of the way. Everybody needs to be on Emulin. It's a vitamin. It's just like a vitamin. And we're calling all these diseases really lack of flavonoid deficient syndrome. That kind of describes it. I do believe this is a major cause of health issues around the world. We just can't get enough. And I already have told many people that we looked at populations of people across the world, and we found out the ones that were healthiest were the ones that were taking the most flavonoids. And we have, in Emulin, selected the best flavonoids. That's really the main difference. You can't get enough in your modern diet. And of those you get, the ones that are in Emulin show the very best bioactivity. The number one issue across all diseases is inflammation, because even if it's not an inflammatory related disease, the inflammation affects your body's ability to deal with that disorder. So it may not, it's that, again, it goes back to Emulin is for everyone, whether it's an inflammatory response or not. Your body gets worn down by the constant inflammation. So let's talk a little bit about arthritis. You know, there's 100 different arthritis that are caused by a lot of different things.
Right.
But 75% of arthritis falls into two categories: osteoarthritis or rheumatoid arthritis. I know all of you know these things, but this is just for review. Osteoarthritis is bone, has to do with the bone, because there is often bone growth and calcium growth associated with osteoarthritis. Osteo means bone. So we have bone joint arthritis. And then we have rheumatoid arthritis, which is actually, the underlying results are almost identical, but it's specifically due to an autoimmune response, which is a very strong inflammation response. So we've got non-inflammatory arthritis and inflammatory arthritis. And that inflammation comes directly from an autoimmune response in rheumatoid arthritis. But they are actually, really the underlying is the same. And we'll go through that here and you can see that. And, you know, actually the only main difference between the treatment of these two is that usually physicians pile on a lot more inflammation control on the rheumatoid arthritis. So you have a low-grade chronic inflammation and low-grade chronic inflammation that it's almost not detectable in the osteoarthritis. But still, nevertheless, the tissue in the joint begins to break down. And you have this further problem is that you have pressure on the joints. And eventually you can get to bone-to-bone contact through loss of cartilage. So it's often mechanical. So osteo is thought of as being mostly mechanical related. So how does that happen? Well, if you think about it, it can happen from injury or pressure from being overweight. So the highest correlations are between a mechanical injury to the joint and also obesity. Now let's talk about how does that pressure get there? Is it just being overweight? All right, just one moment, please.
Is everyone on mute?
I think it was on his end.
Hard to say you're on mute when you're on mute.
Okay.
As a chiro, of course, I'm dealing with those joint issues daily.
I'm sure you are.
Yeah. But even then, it's hard to get it across to people as far as people say, do I have arthritis? They come in with a sore back and say, do I have arthritis? And I always say Latin for inflamed joint is arthro, meaning joint, itis, meaning inflammation.
Yes.
Yes, you do. If it's chronic, then that's when you see the breakdown of tissues and the bone spurs and disc degeneration and all that stuff, which we all develop. But it needn't be painful. There's lots of people with the markers for arthritis or, you know, on an x-ray, they don't look good, but the inflammation isn't so active and they don't have much pain.
Right.
So guys, I'm sorry. I had a bunch of people come into that room I was in. I thought I had it private this morning. About 5 people just showed up. So I know that messed up the recording, but
Hey, that's okay.
let's get back on it. So, and I'm sorry, I had to move into a bedroom. So I hope you don't see any dirty underwear laying on the floor or something. So we have osteoarthritis is mechanical in nature, either comes from an injury or from pressure, and pressure from being overweight, obesity. But this is really very interesting because losing weight helps, but the highest correlation is loss of fat tissue. So studies that have looked at these correlations have shown that it is not just loss of weight. It's also mainly from loss of fat tissue. So it's why it is thought that the metabolism of fat tissue is directly involved in the development of osteoarthritis. So it's not purely mechanical. You can certainly lump it in the mechanical category, but there is absolutely some physiology going on here. And if you remember some of the slides I presented to you in the past, it's that fat metabolism that causes it's fat metabolism, and which is involved with non-esterified fatty acids. That's the marker, non-esterified fatty acids. The more of those in the bloodstream, it appears that you are more inclined to osteoarthritis, and it has nothing to do just because you're heavy. Now, of course, you can absolutely see you're heavy, more pressure on the joints, low-grade inflammation, eventually the destruction of the collagen and calcium metabolism gets out of whack. So we have to get that back in balance. And you can see that Emulin, Emulin absolutely manages adipose tissue growth and development and fat metabolism. Now, I don't have the specific chemical markers where that interaction is, but what we do know is Emulin regulates adipose tissue metabolism, actually directly involved at the growth and development G1 phase of adipose tissue cells. So there's a spot right there for Emulin to help with osteoarthritis by reducing the amount of adipose tissue. And again, people have told you they may not have lost a lot of weight, but they know that their body size is becoming smaller. And that is a direct indication that they are losing fat tissue and not muscle tissue. And again, fat tissue is not as dense as muscle tissue. So they're losing fat tissue. And that therefore is one of the reasons people report improvement with osteoarthritis. As far as treatments go for that, usually it's just pain medication, usually NSAIDs, but pain medication. Cold compresses work. Hot compresses do not work on osteoarthritis. In real legitimate clinicals, hot packs have had no effect, but cold packs do. So let's give some, people want painkiller. I mean, that it hurts. This is a terrible disease, a lot of pain. So we give them some painkillers. Let's go back to Emulin. Gallic acid is almost an analog of aspirin. It does not have the issues that aspirin has because it doesn't work on the COX-2 pathway. It's not a COX-2 inhibitor, but it helps with general nerve function and will reduce pain. It will reduce inflammation, and it does manage fat tissue growth and development. So of what we know about osteoarthritis, Emulin can be a great benefit. Usually you have the joint tissue, the collagen, and it starts to deteriorate eventually. It does go into an autoimmune response, and the body starts chewing away at its own collagen, but not nearly as much as rheumatoid arthritis. It's just a little bit. It's just like 5 or 10% of the total parameters in osteoarthritis. But there is certainly an autoimmune response there, and we know that Emulin helps to eliminate, relieve, ameliorate autoimmune responses. So let's move on to the big daddy. That's rheumatoid arthritis. It is an autoimmune response, and it's not just the joints. It's the entire body. It's called rheumatoid arthritis because this is where it was first discovered, the symptoms in the joints. But we now know that rheumatoid arthritis, the underlying causes, are a whole body autoimmune problem. What do I mean by that? It means what shows up in the joints is actually showing up all over the body. It can happen on the skin, the heart, the lungs, kidneys, all organs, where basically the body starts eating itself alive. It makes antibodies to destroy its own cells. Those antibodies are called RF factor. RA factor, which is rheumatoid arthritis factor, and has been identified as an antibody that our bodies make that turn around and destroy itself. So it is gone into that second stage of body defense. The first stage being inflammation for any problem, but now we're actually moved into the active part, which is the production of antibodies. So I've got some pretty interesting information here for you, and this is pretty recent. Myricetin, one of the major components of Emulin, has been shown to reduce this antibody, as well as to greatly reduce the enzyme that dissolves collagen. So you have your body trying to eat itself alive, dissolve its own collagen, and getting back to that bone-on-bone joint problem. Emulin has been shown to reduce both of those, the antibody, RA factor, as well as the collagenase. And that, well, it's only been done in mice so far. That's good enough for me. Emulin's not going to hurt you.
Right.
Take that Emulin, and you will find out that your collagen is not dissolving, and you have less RA factor in your blood. Now, that's how you diagnose rheumatoid arthritis. You actually look for that marker, RA factor, and that tells a physician that they have the rheumatoid arthritis as opposed to osteoarthritis. In the early stages, they're identical. In rheumatoid arthritis, you also have bony plates develop, bunions, these same things, calciferous growths, but these growths can actually also be in the skin. So, you know, the whole person, whole man, whole body. The little pinky affects the upper left earlobe. You've got to treat the whole patient. And I know most all of you are taking that approach, and I appreciate that. That one part does affect the other. And in this case, rheumatoid arthritis, that person is sick. And their problem is inflammation. It's absolutely demonstrated that tumor necrosis factor alpha, TNF alpha, is the kingpin, the linchpin that causes the inflammation cascade associated with rheumatoid arthritis. Well, of course it is. Tumor necrosis factor alpha is the chemical that starts all the inflammation pathway, from a bee sting to arthritis to broken bones to whatever is going on with you. If there's inflammation, it's tumor necrosis factor alpha that has started it all. And we know that Emulin absolutely inhibits tumor necrosis factor alpha. I mean, that's the beauty of it. It does not eliminate it. It's still there when it's really needed, but it moderates it and keeps it from going crazy and wild. So in rheumatoid arthritis, you have a severe inflammation onset caused by tumor necrosis factor alpha. That in turn causes antibodies. When you get into the second stage of defense, it causes antibodies to be produced by your body, which start attacking all your cells. And then you also have the things like collagenase come on the scene to try to dissolve the collagen. You know, our bodies are brilliant. Every day I'm more and more amazed. But it's still operating on an automatic system. And it doesn't, after a while, know it's chewing up its own collagen. So we just have to work with that. There's currently no drug or treatment to reduce that collagenase. That's the enzyme that dissolves collagen. Except we know for fact that in mice, myricetin, Emulin, will reduce that collagenase activity. So it looks to me that Emulin is indicated in any type of arthritis because it will specifically reduce the inflammation. It will specifically reduce the enzymes that are dissolving your body, and it will reduce the RA factor, which is the set of antibodies that destroy your joints in particular. So I was really glad to know this because it's not just inflammation. It's not just inflammation. So I don't like really to say, hey, this
Right.
Emulin treats inflammation, and so that's why you ought to take it. I like to understand the actual underlying chemistry so we can be very specific. Just like you say, well, aspirin is a pain inhibitor. Well, how does it do that? Okay, through the COX-1 and COX-2 pathways. And that's actually why, by the way, that aspirin is not good for your stomach, is the mucose in your stomach lining that's produced in your stomach lining is the first part of that pathway is also COX-2. So if you're eliminating the pain, which is involved in COX-2, but you're also reducing the production of mucose in your stomach, and that's why aspirin causes your stomach to bleed. So that we need to understand those things so we know what we're talking about. Aspirin reduces pain, but it also reduces the production of mucose, and therefore your body's acid starts to dissolving its inside lining. And so here we are understanding how is it that Emulin works to treat arthritis. Yes, it's a general anti-inflammatory, and it will go a long way to reduce the pain, the swelling, but it goes further than that in that it actually inhibits the antibodies that are starting to chew your cells up, and it inhibits the collagenase, which is the enzyme that dissolves your collagen. We can get back to another problem with arthritis is that the collagen fibers themselves, once they break down, they remain in the joint. And so you get even further inflammation because the body is trying to diffuse these collagen particles, these strands. They interfere with the operation of the joint. So they're back into more inflammation. More inflammation. It's a cycle that feeds on itself. You've got inflammation, and then you've got a breakdown of collagen. Those particles cause more inflammation. We got to stop that cycle. Okay, Emulin reduces the breakdown of that collagen. So even from that, you will have less inflammation. It's a myriad of responses, biochemical pathways in the body that Emulin works on. It's not unusual. There's a lot of vitamins similar that have multiple pathways that they inhibit or not just suppress it and sometimes stimulate responses. And not just one, you know, they're not just an antioxidant. That's just too simple. They're not just an antioxidant. It's not just an anti-inflammatory. It actually works on with your body to have good joint health. In the case of rheumatoid arthritis, it's overall body health. Rheumatoid arthritis in the joint is just a symptom that your body is in an autoimmune state and is dissolving itself throughout your body. It's a whole lot more serious than it appears, even though the arthritis by itself is very serious. It's a symptom of some very severe problems going on. And if you see someone with rheumatoid arthritis, you can also know that their lungs are slowly being destroyed also. The lining around the heart is also being destroyed. The skin will start having nodules on it because the body is attacking itself throughout its own system, not just the joints. So let's just repeat that a little bit. We've got osteoarthritis, which is mainly due to a mechanical injury or pressure. However, we also know it's not just pressure from being, for instance, overweight, but the fat tissue itself has some physiological impact on the joints. We do not know what that is, but we do know that Emulin will manage growth and development of fat tissue. So if we can reduce the fat, not just the weight, but focus on reducing fat, then we will have less osteoarthritis. Then we have rheumatoid arthritis, which is a runaway inflammatory response, and we need to work on reducing that inflammation, number one. And the best inflammatory I've ever found is what's found in Emulin, much better than any drug that can be given. Remember, this is not a drug. We're not treating a disease. We are helping the body heal itself.
Right.
So can I take any questions or something here?
Yeah, Dr. Joe, in rheumatoid, there's been found mycoplasma in some of the toxic bacterias. That's been indicated for in rheumatoid. Could you speak on that a little bit?
Yeah, well, absolutely. One of the ways that you can have rheumatoid arthritis show up is through invasion.
Right.
Yes, bacteria, there are some viruses, and if we can eliminate those, certainly that will eliminate the source which is causing the inflammation. The inflammation is there to try to get rid of any type of toxin, mycoplasma, bacteria, etc. in there. So we know that infection can lead to inflammation, but in the case of people with rheumatoid arthritis, their inflammatory response got out of control.
Yes.
So it shows up to hit the bacteria, the plasmids, and it ends up just chewing everything around. That's just it's the old story here. Inflammation is great, but for a lot of individuals, the inflammatory response gets out of control. This is why we need to have Emulin in our bodies, so that when good inflammation does show up, it does its work and then it goes away. As opposed to just staying there constantly over and over, more and more macrophages are sent to the site and they start trying to chew up the bacteria when they chew up the house too.
Right.
Like burning down your house to get rid of the termites. So we try to control that it doesn't light the whole house on fire. Okay, come in there, let those macrophages do their job, white blood cells show up, and we need to get rid of the plasmids, absolutely, so then there's no more response to them because they're not there. But in many cases, we can get rid of these viral and bacterial particles. The inflammation continues in those individuals because they have an autoimmune problem.
Yep. I can see, from osteo, from rheumatoid, and from even ankylosing spondylitis, it's a tremendous inflammatory responses occurring.
One of the things that I'm noticing, or I think is a big factor in that, is most of these people with osteoarthritis or rheumatoid arthritis have been on COX-1 and 2 inhibitors, which are then triggering leaky gut syndrome, which increases the autoimmune response. So talking with patients, I say it's a little like borrowing money on your credit card. You get the fund today, but you pay back tomorrow. And Emulin's got a real challenge to help with that as well.
Yeah, you're exactly right. It is just like borrowing on your credit card, because you're going to have to pay back with interest, and it'd be outrageous interest at that. So, I'm not an anti-pharmaceutical guy. I've been in some situations I was really glad to have some morphine, I'm telling you. And in fact, I told the doctor I actually had malaria at one time. And it was out of my head. And I said, it was worth the malaria just to get that snort of morphine up my nose. I felt like I had gone to heaven. It's easy to see how people can get hooked on these things. But see, that is treating a symptom. Right. And if we do not address what's going on, just like if it is these plasmids, we've got to get rid of them. But at the same time, it's not the plasmid that are really causing the problem. We've got to tackle the inflammation. So let's get rid of the insult. And if you listen to my talks, the biggest insult we can have in our lives is sugar. Mm-hmm. Lower and reduce that, and then take care of the inflammation, you'll be healed. And similarly, if it is caused by an infection, an invasion, let's get rid of that, but let's also tackle the inflammation. You've got to do two. You can't just treat either one of them peripherally and expect the underlying problem to go away.
As well, there's a pandemic of opioid overuse, and that has all been for pain. So pain of inflammation. And so governments are now looking at how can we reduce this opioid crisis. And if we could only lead them back to just simply starting where we should have started in the first place.
Well, when I am injured, I go to a doctor. I don't really just don't want to hear him say, put some cold compresses on there and it'll get better in a week. I say, help me now. Well, yeah, what we need to do is like moderation. We need to probably have a little bit of both and get rid of that pain, but immediately begin to treat the underlying injury. That's a really important point you just made about that opioid crisis, because I'm actually writing a book right now on opioid crisis and how it happens and how we get addicted and how the pharmaceutical industry absolutely has been shown pushed that. And then we end up getting hooked and say, well, these are really nice, safe painkillers. That's where it started out. And there's no indication that you can be hooked on this stuff. Well, we know that's not true now, but that was the story. And if you go back to 100 years ago, you guys might remember reading about the opioid wars, where the British government took over countries in Asia in order to keep the opioid trade going. And then how the industry there was indications that it was destroying people's lives. It was whitewashed, and the government and industry got together to make. I remember that pyramid you just showed us at the beginning of this call. A pyramid where things like opioid were great for you, and you ought to have a lot of them. Well, the book is about just like that, but it uses sugar instead of opioids.
Oh, wow.
You look at what has happened, it's parallel. It's a parallel story. And pretty interesting how you come across things like the opioid wars, which happened in the sugar industry. Let's keep the supply going. Let's ignore that there's an issue here. Let's not talk about you can get hooked on processed sugar, refined sugar. You absolutely can. I mean, people don't want to be overweight. My goodness. We have a woman in our own midst, in the Igalian midst. She was 560 pounds. 560 pounds. I won't tell who it is. She'll tell you if she wants you to know, but I've seen the before and after pictures. She did not want to be like that. And she lost a few hundred pounds. Pretty remarkable. But she didn't want to be like that. She was hooked, and she was able to get out of her addiction. It's an addiction. And now she's living a much better life. So, yeah, we got to be very careful. Let's look at what's happening in these diseases. What are the indications? Let's treat the actual underlying physiological problems, and then the inflammation will go away. The insult will go away. I wish I could say it was a perfect panacea for everyone. It's not. Everyone is a little bit different genetically. Some people are not affected by a caffeine or aspirin, for example, and other people does work and other people doesn't work. I do believe, though, every time I've looked so far at people say Emulin doesn't work, I found some other reason ultimately of what was going on. And that's why we do clinicals. They're expensive, but that's the only way you can find out what is the real cause and effect going on here, instead of people saying, well, it doesn't work, or it does work, or I got a headache, or whatever. You will eventually find out there's something else that was going on there that only a clinical can provide. That gets us to another problem, and you guys are all tied into this. Alternative strategies, alternative treatments, alternative medications. We're not going to see the clinicals on those guys. Clinicals are paid for by the government and by pharmaceutical companies. And if you can't make a buck, you're not going to do a clinical. So I know all of you feel that there's instances where cold weather coming on changes barometric pressure, seems to irritate arthritis. I myself can feel changes in my joints when barometric pressures change. Is it real or is it not real? Well, all clinicals so far have said that it's a fantasy. There's no correlation. And the studies, though, have been very poor. It costs a lot of money to do a study. Who's going to pay someone $125,000 to do a little study on whether cold compresses help someone with arthritis? Or who's going to pay for these hyaluronic acid treatments, chondroitin, things that we think, yeah, I think this is working. But to do a real clinical like that, it costs money. Who's going to pay for it? The government is not going to pay for it. Large pharmaceutical companies are not going to pay for it. Even our study, the first one we did on rats, I mean, that's $100,000. Then when you move into humans, $250,000. We spent about $2 million so far. And I'd like to get some of that money back, I'm sure. So I'm depending on you guys to get the word out, to get this to everyone. Emulin is for everyone. We want to help people. But that's why you find out that these treatments that we think work, some of these Chinese medicines and some of these supplements that we say, you know, I've seen good results. We can't get a good clinical on them, though, because no one's going to pay for it.
Right.
The other challenge is that they are botanicals. So the absolute purity, there's variation in botanical derived items. So the pharmaceutical companies rely on utter consistency in their products. And one crop of curcumin might have more, or turmeric might have more curcuminoids and things like that.
Yeah, that's right.
The thing about joint pain with changes of weather, my understanding is that you've got dissolved gases in the synovial fluid in the joint. And as air pressure drops, it presses outwards on the joint capsule. And that pressure, if the joint's inflamed, hurts.
Yeah, actually, just last month, that was shown where the sound comes from when we crack our knuckles.
A friend of mine did that research.
Oh, did he?
Yeah.
Well, how about that? Yeah, and I've heard a lot of theories about where that sound is coming from tendons popping back in place, but it's from the those little air bubbles, if you will, gas bubbles.
It's like pulling a suction cup off a sheet of glass. The edge of it vibrates as you pull it off. And someone with an arthritic joint will not. It's like pulling a suction cup off a sheet of sandpaper. So those joints aren't as noisy.
Yeah, that's pretty cool. So now I know why my knuckles pop. I don't know what good that does. But
Mom always used to say, don't crack your knuckles, you're going to wind up with arthritis. And here I am at 75 with no arthritis.
Yeah, there's no, but there is no correlation between cracking your knuckles, generating that sound, and any injury in the joint, because now we know it's not through moving those tendons and cartilages around. It's actually kind of like pulling a vacuum.
Yep.
So,
and actually, stillness of those joints is worse for them than movement. Of course, movement is life. So,
Dr. Joe, talk a little bit about dosage with someone with severe osteo and rheumatoid.
Okay, so generally we set the dosage of Emulin for a slightly overweight male.
Okay.
And 750 milligrams a day appears to saturate their blood. Any more than that, you will eliminate it. However, there's a lot of times where a higher dosage is indicated. One of them is if you took higher dosage, you would be certain to have your blood saturated. That's what we're going for, to saturate the blood.
Mm-hmm.
And if someone is overweight, they absolutely need to have more. I try to say about more or less one cap. Right now, on our current size of our capsules, we should have one capsule for every 100 pounds of person. So that's how you will know how much to give a child or a pet, a dog, or someone who's very overweight. They absolutely should increase. The second thing is the excess Emulin above that saturation level moves to the skin and the joints and to the extremities. And we can end up, therefore, by putting a higher dose, we can cause there be a concentration of Emulin in those areas. So that's why I do say someone who has a severe problem, even if they're not overweight, yes, if you take it, or a skin disorder, take much more than needed so it will migrate to the extremities, and your skin, and you can end up concentrating Emulin in those areas, and you can see much more bioavailability.
I've seen higher doses from anywhere from 4 to 6 with a couple of people I've been working with knee and knee problems for 20 years, and within 4 days at the higher dose, all pain's gone. And now he's titrated down to 2 a day and he still is free of pain. So it's the dose did help.
Increasing the dose did help. Yeah, I see it. And, you know, I'll get back to dose. Well, it's expensive. I know it's expensive. I'm sorry it's expensive. But it has to do with the purity that was just mentioned in these other types of extracts like turmeric. This product is really pure, and we're pushing up to the 98 and higher percent, and that's expensive. If we left it like 50%, you could, you know, I don't know what's would be coming along with that miricetin, chlorogenic acid, et cetera, because you have 50% of other products in there that are not tested and can be deleterious. So we have very high purity. And that is an expensive process, and it's one of the reasons that Emulin does cost what it does. We are working constantly to reduce the costs. The best way to do that is through volume, and we can bring this cost eventually down so I can feel much more comfortable telling someone to take 8 a day if needed. Mm-hmm. But do tell them that, yeah, you're not going to have to stay on these 8, these 6, these 4 for the rest of your life. I take the higher dose, 2 weeks, 1 month, or whatever, and then you can titrate down, revert, pull back out of that down to 2. And, you know, I'll tell you, even some people get along well on 1 after they get themselves completely inflammation-free.
The half-life on Emulin, once you... how long does it take to, I think you mentioned 48 hours or 72 hours?
Yeah, this is actually about 4 days.
4 days, okay.
That does not mean, though, you can take a capsule once every 4 days and it be the same.
Right.
Because we're talking about half-life, and that means what that means when you drop down to 50%. Bioavailable in your bloodstream. So you already, but it does, if you do, it also means though, if you miss a day, you can come back and get yourself back up to level. It's not, it does have a half-life of 4 days. So, you know, and that means another 4 days, it'll be 25%, and another 4 days, it'll be 12.5%. And you've already gotten way past the effect amounts in your blood. So, but you can't, doesn't matter also when you take it during the day though, because of that half-life. You could, taking morning, night, I take it, I don't have any actual schedule except when I'm able to make this smoothie I make for myself every afternoon. But if I don't do that, I just take it when I see the bottle, so I won't forget. It doesn't matter. When someone is initially on Emulin, before their blood is saturated, it absolutely helps to take it with meals. But once your blood is saturated, it doesn't matter.
Okay. I'm going to divert a little bit here from the osteo and rheumatoid. Got a question that came in about the neurological system, the nerves. How can Emulin affect the nerves? Injured nerves, injuries. Talk a little bit about that.
Well, in particular, gallic acid, which is a major component of Emulin E, has been shown to, in layman's terms, put the insulation back on nerve fibers, the dendrites. Also, it improves firing across the synapse. That's it's not like a lot of people think. It's not an electrical jump across that joint. It's actually a chemical joint. The charge moves down the nerve fiber and then generates the release of a chemical that then floats across the joint, the synapse, and then binds on the other side, and then the electrical signal continues, and this happens in milliseconds. So gallic acid has been shown to re-insulate the wires. That means it's great for Parkinson's, those types of disease, Hutchinson's, people that have problem with their nerves basically short-circuiting. And it also improves the chemical flow across, the chemical signal across the joint, the synapse, where two nerve fibers meet. That there's a lot of diseases that have to do with that firing right there at the joint. If you can see, if the chemical goes straight across and hits its target on the other side, that's good. But if the chemical is generated and it goes out sideways or doesn't make it across to the receptor on the other side, that leads to some problems, such as directly related with Parkinson's. It's very frustrating because I know we have a treatment for some of these neurological disorders,
right,
such as Parkinson's. And there's a couple of famous people that have Parkinson's. A lot of people do, but in particular are, I'm going to forget their name now, the guy that played in Back to the Future. Do you remember him?
Michael J. Fox.
Yes. So he's got Parkinson's, and our group contacted him and said, you know, hey, we got something you should at least try. And of course, it was just get out of town. Who are you? We're talking to the world leaders in Parkinson's disease, and it's just dump more drugs on the situation and can't make any inroads. On some cases, though, we are making inroads. We have Jackie Stewart, if you remember him, the world famous Formula One racer.
Yep.
It appears that he's willing to try this product, and so that'll help with the credibility of other people. That it'd bring this whole issue to light much better. It's really disturbing. You know, my own family, I've got diabetics in my own family. They don't believe me. Most of them do, but they just say, wait, I've checked with my doctor and he says that that's just voodoo. I said, well, here's a clinical study. And then there's another reason why. Well, you know, the study wasn't big enough. I said, well, here's a second study of over 100 people. Well, you know, come back when you've had 5 years and all the way up to phase 3 and 4 clinicals, and then we'll look at it. That's all I can do, you know.
It would seem that Emulin would be well indicated for things like MS then, because that's a demyelination disease.
Yes.
Plus, that gallic acid molecule is small and gets across the blood-brain barrier. So for all brain type of things, I felt a difference when in the E. Just in my head.
Gallic acid is a primitive flavonoid. It's the smallest one, and it absolutely goes right into the brain. And yes, multiple sclerosis is MS is horrible, debilitating. And while we say, you know, you've got nothing to lose. To try it, this stuff comes out of food. Well, you know, cyanide comes out of food also. However, I pull every card I can. You know, I say, hey, it just comes from grapes, and why don't you at least try it? And it's just no. I'm well balanced. I'm under drug regime. My doctor doesn't want to change anything, and I'm not Don Quixote. I'm just not going to tilt against these windmills. I got to realize where I can win and where I can lose, and put most energy into where I can win. And I do feel that this iGallium group is the winner.
Do you know, in the area of osteo and rheumatoid, as we start breaking down the collagen, the collagenase, and the byproduct that's left, that affects the central nervous system also, and the whole function of the body starts breaking down. It's gonna calcify the joints and the nervous system.
Yeah, you can't just treat one thing. You've got to know what's going on. And what can we say to people? We know this,
right.
But we know that. So, but we say, well, you really ought to take this because your whole body is under attack, and we're still back into this cycle. Okay, well, I'd rather take this other pharmaceutical over here. Now, I'll tell you also, you know, I don't know if a lot of you remember or know Dr. Rajan's story. He was the youngest drug rep in Asia for, I think it was Bristol Myers. I don't know if that was a company, but it was one of the big ones. And
Novartis.
And he said, well, what about all these side effects? And they said, well, this is good for us marketing because people believe the drug is working. If there was no side effects, they wouldn't think the drug was working.
Oh, wow.
They want to see that slight headache, that little bit of drowsiness, or the little aches and pains in their gallbladder issues, and said, you know, this is a powerful drug. And that's how we know it's working, because it has all these side effects.
Part of the placebo effect.
It's one of the reasons that that and others that he left and wanted to go the naturopath route.
Mm-hmm.
And none of these people that have these conditions are asking their doctor, should I change my diet?
Yeah.
Why do I have it in the first place? You a couple of weeks ago or a month ago maybe already, you were talking and brought up this term flavonoid deficiency syndrome or disease, which got my wheels rolling in a major way. And if I can do a little screen share here, I put up a little piece that maybe you'll enjoy if I can get that to work here.
Yeah, I would. I would. I want to build on this. This is the problem.
I don't know if you can see that or not.
Yes, I see that. I do see that. Good.
That's good, Ron.
Well, you had put together a list of things, and I just remembered from that list, and I put those under there. What are the causes, and what are the symptoms, and what's the solution? Good diet and Emulin. It's pretty basic, really. But we got to make that paradigm shift. And Ken, with his pyramid, he sent that little graphic over to me, and what I did is I put that up on a screen and started playing around with it in Publisher, and Ken hasn't seen this yet. I worked on and refined it a little bit more since last we talked. But it's something that we got to get people changing their minds about, because then we can be talking the same level. Because if they're just talking to their doctors all the time, the doctors, they don't have any clue about nutrition whatsoever, so they're not going to make any suggestions there. You just take these drugs and, well, if the side effect doesn't work, we'll take this drug to counteract the side effect from that drug. And
yes,
that's where we got to change.
That's right, because naming this flavonoid deficiency syndrome, it does give us a place to talk, because people do understand syndromes and diseases instead of saying, okay, just change your diet. That just doesn't sound like a treatment to anyone, because for hundreds of years, we've been told that, you know, you got to identify the disease, identify the synthetic molecule, and that's the treatment. So now we can at least talk about a flavonoid deficiency syndrome, and here's the treatment. Okay, why can't you just eat those beautiful fruits and vegetables and do it? And I remind you, because they're just not in there anymore. We've bred them out, and you'd have to eat 10 pounds of grapes and 2 liters of green coffee or green tea and about 5 pounds of onions every day. We can't do that. So this is the word is great too. We have to supplement our diet, not as an extra add-on, but because it's just not enough in there to begin with.
Exactly.
Dr. Joe, a question came in regarding the difference in formulations between the E, the M, and the C with hyaluronic acid and the gallate. Could you just kind of explain the changes and of the formulations and why?
We had Emulin C, the so-called original formula. It was actually our second formula, but it was our first commercial formula. Quercetin causes glucose to be liberated out of fat tissue. And if you have too much quercetin in the formula, then, and you're worried about your blood sugar levels and you're checking your blood sugar, if you took one of our first formula, which had a lot of quercetin in it, your blood sugar would increase. So we reduced the amount of quercetin, and we called that one Emulin C, for people that were trying to control their blood sugar. But this left out a large population of people that were not specifically concerned with their blood sugar. And they were just wanted to be in general good health, and they were not diabetic or pre-diabetic. So therefore, we increased the amount of quercetin and called that M for manage, maintain. So we had two, Emulin C and Emulin M. And it led to a tremendous amount of confusion. Well, what if I want better general health, but I'm in diabetic? I would have said, well, take Emulin C, and then eventually when your diabetes is under control, go take Emulin M. And we got a lot of confusion. So, and then at the same time, I was working on gallic acid for some other projects that had to do with neurological conditions and nerve functioning and pushing more towards inflammation. And so I said, we need to add gallic acid to this formula. This is remarkable. We put gallic acid along with Emulin, we're going to have an even better product. So when we made that move, added gallic acid for all of its benefits, it'd be a good generalized formula, but we decreased the amount of quercetin that was in M. And now we have an Emulin that is for everyone. It does not have too much quercetin in it that will cause your blood sugar to go up. And it has the addition of gallic acid. And I think we've hit the right balance here. Emulin E. So we don't need a C. We have less, the E has less quercetin in it than the M did. The M had too much quercetin for diabetics. And now we have E, where it's safe for everyone and it does good for everyone, plus the addition of gallic acid, which is getting reports back, tremendous reports about less inflammation, psoriasis, across the board, asthma reduced because of that addition of gallic acid. So,
and the change in chloronic acid?
The chlorogenic acid.
Chlorogenic acid.
The chlorogenic acid is the same concentration in all of them.
Okay.
And the reason you might see green tea on one bottle and green coffee on the other, remember, these extracts are pure.
Yes.
So it doesn't matter where they come from. But as far as a labeling regulation goes, we have to list the source.
Correct.
Once we did green coffee, the Canadian government said, we don't want nursing mothers to take anything that is associated with green coffee because we think that there will be catechins in there.
Right.
And catechins have been shown to affect the development of a baby negatively. So we never had any catechins in there. But nevertheless, the Canadian government says you can't use green coffee.
Right.
So we switched to green tea, and then the same thing happened with the green tea. There's catechins in the green tea, and so they said, well, that's really bad. But fortunately, they let up on the green coffee labeling. So we were able to go back to green coffee. So that's why we've got some that have green tea and some green coffee. Guys, it doesn't matter if I got out of honeysuckle flowers.
Right.
I could do that. We look for a pure source from companies that are regulated by the U.S. government, FDA, the production facilities, and we know it's high quality, but this is all labeling issue. So that's the chlorogenic acid itself, though, is the same amount in all of the formulas. The change is E has a little more quercetin than C and not as much as M. And E has the addition of the gallic acid. I think it's a really fine formula. You know, maybe we continue to do work here, and there might be next year we add something else if we find anything that helps better. But right now, Emulin E is a great formula for everyone.
I'm wondering, Joe, if you'd be willing to look at the two things that Ron has come up with and give us your impressions and any thoughts on it.
Yeah,
perhaps if it's okay with you, Ron.
Yeah, I can email them to you.
And then we can get them to Jen. And if corporate likes them, then we can make them available to everyone. We've been asked for that.
Yeah, I just did glance at them there, and they look pretty good. Send them to me and let me look at it in detail.
Well,
Yeah, and your feedback.
Okay.
Questions? Anyone else?
Yeah, hi, this is Harlequin. I'm in a mall setting, so you might not be able to hear me very well. But Dr. Ahrens, first off, thank you for doing this for us. It's greatly appreciated. But one of the things, personally, I'm missing the quercetin because I'm starting to gain weight. But the main reason why I wanted to ask a question is that my sponsor, Mary Duffy, who I know you've met, she just got some results back from her doctor yesterday. When she was on the C, her cholesterol had gone down. And now that she's been on the E she's been on it for a little while, she just got her results back and her cholesterol went up 200 points in the last 3 or 4 months. Do you have any recommendations for her?
Well, I'll be glad to look at that more in depth. In the meantime, she's just increased her dosage, so she'll get a little bit more miricetin. There's no reason, there's not any possible way that an excess amount of any of these flavonoids can cause your blood sugar or your cholesterol to go up. Maybe she would like to have more miricetin, because the gallic acid does displace some of the miricetin in the capsule, but would have to be taken horse capsules. So in the short term is to increase the Emulin E dosage and see what that does to her. And I'll look into this cholesterol business, but I can't see physiologically how that would change increased cholesterol. Cholesterol will come directly from blood sugar. I mean, that does not come from fats. It is well established now that increased glucose in the blood causes an increase in cholesterol. I also would like to challenge the belief about the cholesterol science right now, that I don't believe that there are actually directly any cardio events attached to increased cholesterol. If you have a cholesterol blockage, that was put there because the cholesterol serves as a bandage that is trying to take care of some inflammation in that vessel. It's not there because it was just too much cholesterol and it clogged up your artery. It actually is trying to make a patch to get rid of some insult that's underneath that patch. So we need to attack what is causing the problem, which is inflammation. And then there would ultimately be less cholesterol because the body wouldn't need it anymore. But I'd like to argue with any physician that said that cholesterol is what is the cause of the problem. I think that the problem comes from the side effects of the drugs like Lipitor, which cause your muscles to leak. That has caused some issues. By the way, getting back to that opioid and sugar situation, if you list the amount of death caused by opioid addiction, it's minuscule in comparison to deaths caused by sugar addiction. And I'll bring that out in that book too.
That's great. Any other
We'll be
questions?
looking forward to that book.
Yeah, it'll take a while, but I'm working on it.
I mean, and looking at
Thank you.
and looking at the cholesterol, the diet, Ron, the diet plays such a huge role here. Any amount of carbs, sugar is going to increase that cholesterol. And it's been proven.
Yeah, best illustration I heard for debunking that whole cholesterol thing is like if you've got a wound on your hand and you develop a scab to protect. And what caused that in the body with food is inflammation. And if you keep picking that scab, it's just going to regrow and get bigger and bigger. And pretty soon you got a blockage in that artery or in that vein. And it's really not the cholesterol, it's the scab caused by inflammation because you're eating all these inflammatory foods. So
Yes.
we got to get back to the beginning, and making that transition in people's minds is the biggest challenge I think we all have, really.
Yeah, my personal physician does not agree with me. My personal physician thinks that I've got to get my cholesterol down to a certain level, and I actually can move my cholesterol up and down just by changing my diet. I proved it to him several times. Oh, your cholesterol is too high. I said, well, first of all, it's not too high. And secondly, that's because for the last 4 months I've been on the road eating a bunch of crap. And I'll show you, I'll come back in 3 months and I have my cholesterol down to nothing with no drugs. And he scoffs at me. I prove it. And he still doesn't believe me. So it's a long road.
Yeah.
Yeah, I can jump in with just a couple of testimonies here with my husband about that, because his doctor called him in with a high cholesterol and they redid the blood test. Again, he had, I don't know why, but the Emulin had not been taken regularly. He got back to taking it regularly, went back in, completely normal. And she said, well, what have you done? You know, you must have really changed your diet. And he said, no, I haven't really changed my diet. And the other thing with that is his ophthalmologist a year ago was very concerned about glaucoma happening. And 6 months on the Emulin, came back, took the photos of the back of his eyes, and no sign at all of any glaucoma. And I was standing there and said to him, well, is inflammation a cause of glaucoma or contributing factor? And he said, absolutely. So I just want to jump in with, because it's nice to hear how it is working.
Yeah. Okay, guys, let's, we're over an hour and I'm going to have to go soon. So let's wrap this up. I love to be here, but I do have another engagement.
Very good. Anyone else? Dr. Joe, we thank you so much for your time.
Hey, it was good to see you in New York. It was not good to be in New York, but it was good to see you in New York.
Yes, it was.
That snowing there on top of the Empire State Building.
I know.
Oh, the next day though was just gorgeous. It was really, really fun. I had to drive to Boston, and it was pretty good drive. Well, thank you for the opportunity, guys, to be here and talk to you, and we'll do this again.
Very good.
Thanks, Joe.
Thank you.
Get that email to you.
And actually, I'm going to brag real quick. I'm going to show you my booth at the mall.
There we go, Harlequin.